Okay. I have nothing to disclose. I'm not connected to any pharmaceutical company or any manufacturing company. What do you need to do when you have symptoms of COVID-19? We can't tell if you are infected with COVID. What we know is that you have symptoms compatible with COVID-19. We isolate you for 10 days. During this isolation, we confine you to your own room, as much as possible with your own restroom. During this time, you are infectious while you are having symptoms. The nice thing about COVID is that more than 90% get better, usually within that 10-day period. When you do become asymptomatic for at least 3 days, you are allowed to leave your isolation because you are rendered non-infectious. What do you need to do when you are exposed to somebody who has symptoms of COVID? Day 0 is a day you were exposed to him or to her who has symptoms of COVID. From there, you count 14 days wherein you will be required to quarantine yourself. It is much like isolation, but you are not sick. Well, not yet. You need to be quarantined because anytime you may manifest with symptoms of COVID and you may be infectious right before, and while you are having symptoms. If you remain without symptoms for 14 days, most likely you won't be sick of COVID and you are allowed to leave your quarantine status. A different scenario is this. You were exposed to a person with symptoms of COVID, so you undergo quarantine for 14 days. However, sometime in your 14-day quarantine, you manifested with symptoms of COVID. So you start your isolation status, which is for at least 10 days, depending on the resolution of your symptoms. Eventually, you get well. And after 3 days without symptoms, you are rendered non-infectious and you will be allowed to leave your isolation. So what's the difference between quarantine and isolation status? Quarantine are for those who are exposed, or for those exposed individuals and travelers who have not manifested any symptoms of COVID. They need to be quarantined because anytime they may manifest symptoms of COVID. Thus, they can be infectious. Quarantine period is for 14 days. Isolation is for those who are manifesting symptoms of COVID already. They are isolated because they are highly infectious while they are having symptoms. Isolation period is at least 10 days depending on the resolution of their illness. It ends after having symptoms for at least 10 days. 3 days, 3 days. All COVID cases should be reported to the health officials, particularly the LGU Health Office. They will activate the Barangay Health Emergency Response Team, or BERT. It is tasked to assess, monitor, and conduct quarantine and isolation precautions for the COVID cases. Whenever possible, the cases need to be brought to a quarantine or isolation facility. Those that need hospitalization are those with comorbid illness and moderate to severe conditions of COVID. If not possible, home quarantine or isolation Home quarantine or isolation requires a separate room with a restroom to isolate the case from the rest of the household. When do we do COVID testing? When you have symptoms of COVID-19. The viral particles are highly detectable in a person with COVID symptoms. Since you have symptoms, you will be isolated. During the start of our quarantine restrictions last year, the rapid antibody test was employed as a means to determine COVID status of an individual. Eventually, it is no longer recommended due to poor reliability. Currently, protocol is that a symptomatic person can have a rapid antigen test as a screening test. If tested positive, he or she is already considered a COVID test, a COVID case, a confirmed COVID case. So no test is required. No additional tests are required. No, if negative, if negative, the person will still complete isolation period till the symptoms resolve. We see no benefit in doing a repeat test to see if a COVID confirmed case will test negative. The test detects the virus particles only. It doesn't distinguish an active case and a recovered case. The test can still be positive weeks or months after recovery. Sandali ah. A person who is in quarantine can be tested no earlier than 5 days after exposure and no earlier than 5 days on the fifth day of quarantine. When a quarantined person develops symptoms, another test will be performed. During quarantine or isolation, what do we do? Eat nutritious meals, fruits, vegetables, 5 servings of fruits and vegetables. No? Keep hydrated. 8 glasses of fluids will do. No? Do not overhydrate. No? Keep rested. Get enough sleep at night. No strenuous activities in the morning, in the afternoon. Continue your maintenance medications. Continue taking your maintenance medications. What not to do? Do not double or triple dose your supplements if you are taking any. Be wary of products with labels saying no approved therapeutic claims. Do not take medications or use gadgets or tests that are not approved by the Food and Drug Administration or FDA. Lianhua Qinwen capsules are a Chinese herbal treatment that contains ephedra herb, components. No? According to the box, it contains 40 milligrams of ephedra herb components. The Dangerous Drugs Board made a stern warning that it contains 85 milligrams of ephedrine, a chemical that is a stimulant found in ephedra. In most countries, including ours, any medication or substance that contains ephedrine are banned. The Dangerous Drugs Board has given its position that while it recognizes that the herbal medication has a banned substance, it also recognized the authority of the FDA allowing the use of the herbal supplement due to its claim that it is used for treatment for COVID. It has no approved therapeutic claims. However, FDA allowed the use under the supervision of a physician. Taking stimulant drug causes hypertension, abdominal pains, psychosis, and brain disorder. Sorry. Ivermectin is a drug that is used in treatment of a certain parasite called strongyloides. When it was tested in a laboratory for a possible cure for COVID, it was able to kill the virus. However, the dose required to kill the virus is equivalent to a toxic dose to humans. Manufacturers of ivermectin, particularly Merck Sharp and Dohme MSD, issued statements that their drug ivermectin should not be used in the treatment for COVID or as a prophylaxis after exposure to COVID. Drugs tested in laboratories or in animal trials that does not pass the safety issue are not pursued in human clinical trials. Unfortunately, some doctors and politicians dispense the drug as a treatment for COVID despite stern warning from health experts. Personal air filtration systems that hang around the neck do not work as they claim to be. The droplets will land on your face before the device has a chance to do its job. It is an expensive, useless toy. The one in the picture costs $150 in Amazon. After you get out of quarantine and isolation, you need to disinfect your quarters. The general rule in disinfection are as follows. Safety first. You will be using harmful chemicals, so protect yourself by wearing gloves and proper clothing. Ensure good ventilation. The fumes from use of chemicals are just as harmful when inhaled. If the area was vacated less than 24 hours, you need to clean the area before disinfecting. If the area was vacated more than 24 hours, you need to clean it only. However, you may need to disinfect if needed, like if there are presence of body fluids like blood, and so on and so forth. If the area was vacated more than 3 days, you just do regular cleaning. However, there is no harm in doing the extra mile in disinfection. Anything that can be washed with soap and water, you do so. All clothes, beddings can be washed with simple laundry soap. The virus can be killed by simple soap and detergent. Other things that cannot be washed can be disinfected with 70% alcohol. The use of household bleach is the cheapest and simplest disinfecting agent. Always check the manufacturing date. Dispose household bleach a year after manufacturing date. Its disinfecting property cannot be guaranteed after a year from manufacturing. Improper storage like exposure to the sunlight destroys its disinfecting properties. If you dilute bleach for disinfection, any leftover diluted bleach should be discarded after 24 hours. This slide shows how to dilute household bleach based on the level of disinfection. When dealing with body fluids like blood, it is advisable to use a 1:10 dilution. For toys, dishes, table, and kitchen countertops, a more dilute 1:500 is used. COVID virus can be killed using a 1:100 dilution. 1 part of bleach to 99 parts of water. You can use multiple purpose cleaners you see in the market. Some of them are bleach and some of them are a different kind of disinfectant. Just read the labels on how to use them and which surfaces it can be used. Other items that cannot be washed can be exposed to the sun, like your beds, your pillows. I need to tell you some certain precautions on use of ultraviolet light for disinfection. Using ultraviolet light for disinfection is not very practical. It only disinfects, if ever it is possible, only those that come in contact with the ultraviolet light. The other parts that are not uh, that are not being contacted by the ultraviolet rays are not disinfected. There are three types of ultraviolet light, no? The A, the B, and the C. The UVC type is the one that kills microorganisms. It also causes skin cancer. You may see UV-like gadgets being sold in the market, some cute pen light devices, and some are handheld devices that are shown disinfecting paper and money. Most of them, if not all, are just blue light and not true ultraviolet light. So beware of this scam. An ounce of prevention is better than a pound of cure. A century ago, more than half of surgical patients die as a result of surgery. It was traced to soiled garments used by surgeons when they operate. Since then, surgeons eventually discovered the right kind of personal protective equipment, the proper disinfection procedures, and the proper use of PPEs to prevent mortality of patients after surgery. You will not see any doctor who puts down their mask when they speak during operations. Doctors know that when they speak and breathe, droplets are sprayed from their nose and mouth, and from their noses and mouth. The mask does the job in trapping these droplets, thus preventing them from contaminating the surgical area. The mask has a non-absorbable outer layer. The inner, non-colored absorbable layer should touch the face. It absorbs the droplets from the nose and the mouth. Respiratory filters, like the N95 mask, filters particles better than the regular surgical mask. When worn properly, masks can be an effective means of preventing transmission of viruses and bacteria, particularly during epidemics. Here are some guidelines on wearing masks if you are not using medical grade masks. Wear 2 or more layers of breathable, washable fabric. Have a nose wire to prevent air from leaking from the top of the mask. Do not wear masks made of material making hard to breathe, like vinyl. Use masks that completely cover your nose and your mouth. Choose a mask that fits snugly on sides of your face and don't have gaps. Do not wear masks with exhalation valves or vents. Here are pointers on how not to wear a mask. Do not wear your mask on your neck. Do not wear your mask over your chin. Do not wear your mask below your nose. Do not wear your mask over your forehead. Do not wear your mask dangling on your ears. Do not wear your mask covering only your nose. And do not wear your mask on your forearm. Yes, it happens. Here are last pointers in wearing mask. Snugly fit your mask to your face. Choose a mask with a nose wire so you can adjust it to your face, to the contours of your face. Avoid masks with exhalation valves. Your mask should have at least 2 layers of breathable materials. If you double mask, you do so to improve fit or to fill in the gaps, especially if you have a large face, no? Malasyopaw na muka, no? If you need to double up, wear a surgical mask underneath a cloth mask. No need to double mask if you are wearing an N95 respirator. For this pandemic, we employ redundancy of measures to ensure a more effective means of controlling spread of the infection. Aside from the face mask, we use face shields. They offer an added layer of protection should the mask fail in containing droplets from our noses and mouth and droplets coming from our close contacts. At least a meter of distancing offers enough space so as the droplets from one person will not reach another person. We need to wash our hands properly. Sanitize and clean your things and your surroundings regularly. You may see these things as simple measures, but they are sufficient tools to control transmission of diseases. These will buy us time until scientists can find a cure or a good treatment protocol. It is a good thing we were able to come up with vaccines in such a short time. My final point is that behavior matters. Bad things happen with bad behavior. In a pandemic situations, consequences can be life-threatening as a result of bad behavior. Well, this is my last slide and thank you for listening.